Gender-based violence is a major problem affecting girls and women and a percentage of male and continues to claw back on efforts to achieve gender equality and also enhance empowerment of the male and female child. Kenya has expanded the definition to include violence against men and boys. The Sexual Offences Act No. 3 that was revised in 2007 has captured these definitions and also recognizes males as victims of GBV. The United Nations states that violence against women is a manifestation of historically unequal power relations between men and women, which have led to the domination over
pesa hataki chukueni mali yote na mtuache, wasema tutaki yote tutawaua. Sasa saa hiyo kanifunga mikono, akaanza kufunga mkuse, akamtolea nguo yote. Sasa mimi akaanza kunikata mkono vidole nikisikia nikiwa hai, akaanza kunichoma choma mtumbo na nilikuwa na mimba mwezi 8 na nusu. Sasa akaanza kushika mzee akikata vidole akiweka kwa meza akimwambia hesabu kura ni ngapi.
Looking at the statistics of reported and recorded cases, the Gender Violence Recovery Center has supported over 44,000 survivors since inception in 2001. Men are the main perpetrators of violence, exhibited by GVRC statistics at over 90%, while the female population is most affected with 56% women and 36% girls reported cases. Between 39% and 47% of Kenyan women experience GBV in their lifetime, among the highest rates in the world. Men are survivors too, with GVRC reported cases rating at 5% boys and 3% men.
Women rights organizations were able to adapt to really offer emergency support. But we've seen progressively also women rights organizations realizing that they need to also adapt to being now into the mode of recovery. And that is even where we come in as CARE.
Kenya also ratified the Convention on the Elimination of All Forms of Discrimination Against Women. Efforts to prevent and respond to cases of domestic violence against women in Kenya have been there for some years, but the progress has been too slow. Part of this is due to weak institutional capacities.
For a long time, community members thought legal access is for the rich. At COVA, we have lawyers, pro bono lawyers, because it's about the community getting access to justice. I've been able to continue doing my work, but most of what I was doing was referral. Of course, I could not go to the community because of the social distancing and the containment measures, but I did a lot of phone calls. I did a lot of texting, yes, for support and clingage.
What's encouraging is that the government of Kenya has renewed its commitment to ending gender-based violence. In June 2021, Kenya adopted a gender-based violence indicator in the government's performance monitoring framework. This will ensure that the enforcement and implementation of gender-based violence laws and policies are tracked. With this commitment, the government has also allocated additional resources to prevention and response. Gender-based violence recovery centers are being established in all major hospitals in the country. Moreover, gender desks in police stations have been established alongside civil society organizations such as the Coalition on Violence Against Women and the Federation of Women Lawyers in Kenya.
We will invest $1 million every year for gender-based violence research and innovation to boost evidence-based programming by 2026, as well as establish a gender-based violence survivors fund through co-financing model in partnership with private sector, civil society, and other stakeholders for the economic empowerment of all GBV survivors. We will introduce a more geographic health survey to strengthen the utilization of gender statistics and informing the design and scale-up, as well as evaluation of FGM and gender-based violence programming. As well, we will commit to developing a gender-based violence management and information system to strengthen gender-based violence prevention and response programming.
Delighted to be with you here today to sign into law the Sexual Gender-Based Violence Bill. Kenya has a progressive constitution and has made major strides in developing legislative frameworks on response, prevention, and of the sexual gender-based violence. In the past, there was no dedicated body to address the complicity of the SGBV, no obligation to provide extensive education, no safe houses or shelters, no specific budget, which we are urging the members of the County Assembly to approve for us, and basic healthcare services were inaccessible or unavailable to victims. Today, this law will ensure essential services are available to victims of the SGB as a matter of right.
All partners, welcome on board. This is something good for us, for Nairobians. Let us stand up. Let us no longer sit down and say it is happening or keep quiet. There's a lot that has been happening. Most ladies or most men, if it happens to you, the cases are not reported. Now here comes a bill that stipulates very well how you report, where you get help, and we'll make sure that all this is sensitized by the county. We are very proud to have a governor who is willing to support us.
It is also during the tenure of the governor, N. Kananu, that we are hoping to have the MOU signed this week, where GAF, Nairobi County, and NMS, who have been working tirelessly over the last 6 months in various meetings, will be putting up a safe house. And now the safe house is not just hanging in the air. The safe house is actually anchored in law. I hear from Wanjiru that she has a whole paragraph in the law that talks about the need for safe houses. It will be the first safe house run by government. Thanks to the governor and her leadership, we actually have a parcel of land.
I thought it's so critical that people understand that there is now going to be a bill in place that pushes for safe houses, because women are not safe. And by the way, I understand when our male colleagues get frustrated and say, what about us? But it's really not an us versus them. The end of the day, statistics show women are not safe, children are not safe. So if we don't have safe houses, where will people go? If there's no psychosocial support, how will women begin to rebuild their lives? If there's no
This is because victims of violence also don't report what's happening to them. Less than half of women sought assistance from any source to stop the violence they experienced. There are various reasons why this happens. One is that survivors face increased harm due to the failure of authorities to ensure that they have access to fast protection services, timely medical treatment, and financial assistance. March 8, 2022, as the world marked International Women's Day. In the Twitter poll, we asked social media users for their opinion on what between gender-based violence, female genital mutilation, FGM, menstrual health, and gender wage gap is still holding women back in 2022. Out of 1,744 responses received, a majority of the respondents at 68.9% were of the opinion that gender-based violence was the most affecting issue, followed by gender wage gap at 12.9%. At the same time, 11.9% of the respondents submitted that menstrual health was a key issue affecting women and girls, while 6.3% pointed at FGM, female genital mutilation, being a pressing concern. Gender-based violence continues to plague Kenya, with one of the most recent cases being an incident where a gang of border riders sexually assaulted a female driver on Wangari Maathai Road in Nairobi. Regional Advocacy Director at the Psychosocial Support Center, Angeline Siparo, Tuesday said that gender-based violence is not an individual problem but a Kenyan one. According to Siparo, a lot of focus has been given to the girl child, leaving the boy child out of the very important equation.
There are two curves to be flattened. There is the COVID-19 curve itself for the pandemic. And there is the curve for the gender-based violence here in Kenya. So the government and also the stakeholders need to invest in flattening both the curves, because both the curves actually are.
A lot of trust has been lacked, especially with the reporting system, because people really, most of the victims believe they are not going to be heard.
The reason why we're having this fellowship is to try to bring more women human rights defenders and activists and feminists that are able to talk against any form of violence against women and girls, and any form of violence when it comes to human rights violation.
Now the question is, with all these efforts by the government and NGOs, are we there yet as a country in eradicating GBV as a country?
We basically reach out to women and girls. We are looking at the reasons, the causes of GBV. How can we come in to ensure that this young girl cannot be exposed to sexual and gender-based violence? We had to adapt into different approaches and interventions to see on how we can be able now to reach out to our girls.
Number that is provided nationally, but many women don't know about it. 1195. So as we go around giving them the soap, mask, and sanitizer, we'll give them a briefing on that this is not just sanitizer. This is sanitizer to protect you from infections, COVID infection, but also it has a secret number that you can call anywhere without airtime, and you can get a relief. You can get counseling, you can get support.
Reporting for the SHANI TV weekly feature, my name is Neema Titus.
Welcome to Mountain View Gardens Nanyuki.